Hey, good afternoon everybody. We've been called to this young fellow here who is a 8-month-old child who's been stung by a wasp. Mum's a bit concerned that he might be having an anaphylactic reaction or allergic reaction to the wasp. So we've been called. Our first step in the process is to assess the scene and make sure that we're safe, that the wasps have all gone and that we're not in any danger. We've done that and we're happy now. So next step in the process, especially with dealing with a paediatric, is the paediatric assessment triangle. 3-step process. It's a hands-off approach, non-invasive, non-intrusive, and we're trying to gain the child's trust, but also assess them and find out whether we're dealing with a sick child or a not sick child. So the first part of that process, it's a 3-step process, is to assess their appearance, and that can be broken down into the tickles mnemonic, which T stands for their tone. Are they sitting up normally, supporting their own weight, or are they lethargic, floppy, not very well looking? So we assess that. And we move on from there. The next step in the process is we assess the interaction. So the child, whether they're looking around, do they notice us when we come in the room? Are they interacting with mum, or are they in their own little world of pain? Once we've completed that, we then move on to C for consolability. Are they able to be consoled? Just the normal interaction with their mother. Are they able to be settled, or are they in their own world of pain and not able to be settled? And these can all lead to a determination of how unwell the child is. After we look at their consolability, we look at L for look or gaze. So whether or not they actually notice us when we walk in the room, whether they acknowledge us, look up, or whether they're just completely in their own little world of pain. They've got that 1,000-yard stare and they don't care. And the last step in the tickles mnemonic, or the appearance, is we assess their look or their gaze. Do they actually look at us? Do they interact with us when they look at us, or are they their speech or their cry? Are they able to speak or cry? And is it appropriate for their age? And that's where we'd ask mother or carer to let us know. And if they are crying, is it a high-pitched squeal? Is it a painful cry, or is it just a normal sort of whiny cry? After we've assessed their appearance, then we move on to their work of breathing, and that's a couple of components to that part. The first thing we look at is their position. Are they sitting upright? Are they tripoding? Or are they relaxed and just nice, easy breathing? The second part to that is any retractions we might see. Super clavicular, subclavicular, intercostal, tracheal tug, anything like that might tell us that the child is actually having difficulty breathing. We will also look at their flaring of the nasal passages to see if there's any sort of distress there, or any sort of flaring which can lead us to surmise that they are perhaps distressed. And the last part of the work of breathing assessment is we assess any sounds, any adventitious sounds, whistling, gurgling, snoring, stridor, anything like that. Again, that might lead us to believe that the child is in distress. The last part of the process is of the paediatric assessment triangle is we assess the perfusion to skin, or circulation to skin. So we're looking at the pallor of the skin, pale or well perfused, pink and well perfused. We look at any cyanosis we might be able to see. So are they blue around the lips, centrally cyanosed, peripherally cyanosed? And the last part of that process is we look at their mottling. Is there any mottling on their skin? And again, we add all these up and we look and we assess the child and decide whether they're sick or not sick. And that, ladies and gentlemen, is the paediatric assessment triangle. Thank you.